So let us see about the DASH diet. So DASH DASH represent Dietary Approaches to Stop Hypertension. So this is a non-pharmacological management or lifestyle modification can be done in the dietary intake, thereby we can stop hypertension. So now what the diet should have? Diet should have high in whole grains, fruits, vegetables and low fat diet. So then coming with the other supplements, mineral supplements, adequate calcium, potassium and magnesium should be included in the diet. Use of red meat should be reduced and sweets and sugar beverages also should be reduced. So low in saturated and trans fat, cholesterol should be included in the diet. This is the complete picture of the DASH diet. Generally we have enlisted. In the coming slide I will be showing about the composition. This is about the DASH diet pattern based on 2000 calorie diet. So these servings it have been indicated per day. So let us see about the food groups and servings. Grains 6 to 8 servings, vegetables 4 to 5, fruits 4 to 5, low fat or fat free diet it's 2 to 3, then meats, poultry and fish less than 6, nuts, seeds, dry bean and peas 4 to 5 per week it is, fat and oils 2 to 3 servings, sweets 5 per week. Coming with the sodium 2300 milligram. Always you should remember this. Whenever you will be using the term reduce sodium intake, always you should remember the maximum allowable amount of sodium is not more than 2 gram or it should not exceed 2300 milligram. So now the first lifestyle modification in the diet, like they should eat less sodium. It's not, we are not telling stop sodium. This is the confusion will happen with the patient. The patient may tell to reduce the sodium intake, but the patient may stop the sodium because of fear. While counseling, proper counseling should be given to the patient. Even sodium reduction means a question may arise like how to stop sodium, so that you should inform the patient like what are the dietary substances which are having sodium. If you reduce such dietary stuffs, so that automatically sodium reduction will happen. So now this DASH is more effective if you also reduce the sodium. So less than 2400 milligram per day it should be. As I told, like it should not cross 2 gram. Our maximum limit is 2400 milligram per day it is. So reduce slowly. It may take 2 to 3 weeks. Suddenly if you reduce the sodium, so it may not be get some acceptability by the patient because of the alteration in the taste. So that 2 to 3 weeks slowly if you keep on reducing the sodium, even the taste bud will get used to it, and less salt can be continued in the further days. Let us see how to cut the sodium, ways to cut the sodium. While purchasing the items in the market, it's preferable to ask the patient to check the labels, and he should look for these words like low sodium or sodium free or no salt added or sodium reduced or unsalted, so that we can reduce the sodium. Or many times like sodium is a part of an ingredient, so that we cannot avoid it, means we should go for low concentration sodium in the products. So now ways to cut the sodium. How we can cut the sodium intake? It will start with the dining. It's better to remove the salt shaker, whereby we can restrict ourselves to include extra load of sodium into a diet. Add little, if any, salt to cooking. So buy more fresh or plain frozen, not added salt veggies. Because many times in the supermarkets you can observe vegetables and even many meat and fish. So they will be frozen and canned. So in that salt will be added to act as a self-preservative also. It's better to use the fresh one to avoid the packed vegetables or meat. Whenever possible, use more herbs and spice. So then make soups and stews ahead without salt and let flavor blend. And use fresh poultry, lean meat and fish. So we get most of our salt from convenience food. This convenience food can include products such as candy, beverages such as soft drinks, juices, milk, nuts, fruits and vegetable, even in fresh or preserved states, processed meats, cheese and canned products such as soups, pasta dishes, even pickles and chips. So they have high salt content in it. Use unsalted, canned or frozen vegetable. If you want to use this canned food, it's better to check for reduced sodium, and also it's better to choose convenience food low in salt which is available. Use fewer convenience food compared with the labels. So then other ways to cut sodium. Most of the restaurant foods are very high in sodium. It's preferable to ask the patient eat out less often than advising him not to eat, which is not practically possible. So make more food from starch. Using a food label to cut sodium. The sodium is a chemical that makes half of table salt, limited to 2400 milligrams per day. Always look for low sodium or salt free. Watch reduced sodium. Choose more food with daily values less than 10%. Even it's better to balance higher sodium food with low sodium foods. Always it's advisable look for the amount of sodium in the food by finding the nutrition fact labels. Choose food have lower amount of sodium based on the label. Then next aspects in the lifestyle modification, that is, should ask the patient to be physically active. So let us see what are the advantages and how the person can become physically active. These physically active words involves both physical as well as mental involvement. This being physically active helps patient to lower his blood pressure and also lose or maintain weight. It's preferable to ask the patient to take 30 minutes of moderate level of activity on most days of a week, preferably daily. If it is not possible of 30 minutes continuous, he can take the break, like 10-minute sessions he can make. And also he can make some lifestyle changes which can easily happen. Like he can use stairs instead of elevators. You can ask him to get off bus 2 steps early and he can walk. Park your car at far end of the lot and walking can be included. And that extra time may not be required to invest for physical activity in the daily routine task only. It can be incorporated. Be physically active. Include 30 minutes at least 5 days a week. It can be divided into 10 to 15 minutes period. Workup regularly is essential, and it's advisable to ask the patient to involve in physical activity which he can enjoy. You should not restrict it with one type activity. Earlier slide also a lot of examples have been included. We can include any type of physical activity. Let us see about the guidelines for physical activity. It should fit into the daily routine. So aim for at least 150 minutes per week of moderate aerobic exercises. Always it's preferable to start slowly and gradually build up the intensity. The patient should not do more strenuous activity within a day, in the first day itself, because overnight the things are not possible. It may put the patient into worse condition. That's why it's preferable to gradually increase the intensity of the work. So other possibility like wear a speedometer, 10,000 steps. Other inclusion like take stairs, park further away or walk to another bus stop, so that the person will be physically active. Let us see the benefits. Now, generally we are told about the physical activity, only few examples is included, but the patient, whatever the physical activity he will be enjoying, that he can include. The benefits of exercise, like it can lower the blood pressure, the person will have a controlled weight, increases insulin sensitivities, improved lipid levels can be absorbed, and the patient is physically active, improve blood glucose control, even it reduces the risk of cardiovascular diseases and prevent or delay the onset of type 2 type of diabetes. These are all the advantages of being physically active. Now let us see what are the activities can also be included as a part of keeping himself physically active. He can make brisk walking. He can involve in house cleaning work. Lawn care can be taken. He can involve in gardening, swimming, cycling, walking. So then racket, sports, dancing and other activities he can include which he enjoys. The next aspect, it's better to ask the patient to stop smoking and don't smoke, because as smoking is a risk factor for many of the complications. So it causes injuries to the blood vessels. So it can speed up the progress of hardening of the arteries. So thereby it may cause cardiovascular complications. Then the next aspect is limit alcohol intake. You can note the term here. We are not asking him to stop the alcohol, because many times it will become inconvenience and not acceptable also. That's why limit alcohol is a preferable word here. There should not be any confusion while counseling. But excessive alcohol raises blood pressure and even it can cause harm to the liver, brain, heart. But alcohol is an oxidant. So now it's better. Let us see the standard. What counts as a drink? 12 ounce per beer, 5 ounce wine, 1.5 ounce of 80 proof whiskey. And it's better to try to follow a healthy eating pattern. Always being active is a ultimate thing which can improve the condition. Not to smoke, control the weight, and take medication. In summary, we can conclude it's better to make dash food for fruit and vegetables, whole grains and breads, non-fat and low-fat dietary food, nuts, seeds and beans. As a conclusion, this hypertension is a very controllable disease with drastic consequence if left uncontrolled. This hypertension can be treated by diet and lifestyle measures that are as or more effective than medication. But it's preferable to combine pharmacological and non-pharmacological management to get stronger control over the